Now we're going to move into today's plenary session where I'm delighted to be your moderator. The topic, navigating the shifts, the impact of tobacco and vaping on public health. We're going to hear from experts in the field, just for 15 minutes each, around the latest data, the health impacts we need to know about, the effectiveness of current strategies. What are the emerging challenges? The regulatory responses, are they sufficient? What approaches might reduce them? How are these shifts shaping our public health policy? So let's get underway with a fabulous expert in this area. Her name is Associate Professor Becky Freeman. She's from the School of Public Health at Sydney University, a global authority on the potential of the internet to circumvent tobacco advertising. And I think crucially for this discussion, she's the chief investigator of the Generation Vape Research Study. What can we learn? Professor Freeman, welcome to Brisbane.
Thank you so much for having me. I'm delighted to be here. And I would just like to say thank you so much to the organizers for letting me bring my son along today. He's just sitting down there. He's going to, he's 12. And so he's my reason for leaving this world a bit better. And if we advance this way. Oh, how do you advance these slides? Oh, there we go. And I'd like to acknowledge the tradition of custodianship and law of the country in which my university, the University of Sydney campuses stand, and pay respect to those who have cared and continue to care for country. And thank you so much for that joyful welcome to country we had this morning as well. It was such a delightful way to start the morning. So I'm here to talk about vaping. Vaping in Australia, the problem, the industry, and the policy. And when I look around the room, there's so many people in here who've committed probably their entire professional career to making this world a better place, to making us healthier, to making us happier, to enhancing our well-being. And hearing about all the amazing programs that are happening across Queensland and seeing that video of all those children eating all the beautiful fruit, it's so inspiring. But there's also commercial actors here who are trying to undo all that hard work, who want to convince us that things like junk food, vapes, cigarettes, gambling, alcohol, that those sort of industries can somehow coexist healthily and happily and be partners at the table. And I hope by the end of my presentation I convince you that absolutely not, that there is no space for the tobacco industry to be a partner with us in vaping and tobacco control. So what's the problem today? Well, first let's start with the good news. So for Australians over the age of 14, daily smoking rates have dropped by 2/3. So 24% in 1991. Any of you teenagers in the 90s? It's okay, I was one. I was a teenager in the 90s. I had all those images of the beautiful supermodels like Kate Moss, smoking on the runway, smoking in magazine spreads. It was absolutely drilled into us that smoking was glamorous. It was beautiful, it was associated with being thin and sexy, and fortunately that's not true anymore. We see now that only 8.3% of Australians over the age of 14 smoke on a daily basis. That's incredible, and obviously due to a lot of the work from the people in this room. But a little something has come along to try and undo that. And if we look now at the use of e-cigarettes or vapes, I'm just going to use that term interchangeably. Vape, e-cigarette, basically the same thing. We see that only 1 in 5 people age over 14 had used this e-cigarette at least once in their lifetime, and this is up from 11.3% in 2019. So smoking rates going this way, vaping rates much faster going this way. And the current use of e-cigarettes, so not just trying them, but actually using them on a monthly, weekly, or daily basis, has also exploded in Australia. And we're now looking at about 7% of the population over 14 regularly currently using e-cigarettes. And the age group that is most using these products are young adults, age 18 to 24. And I think we often talk about children and we often talk about older people, and we forget about young adults. And if there's one sort of rallying cry I'd like to leave you with today is that do not forget about people once they turn 18. 18 to 24 is such a vulnerable age, and the industry preys on this group. They say, oh, we're not targeting children. We're leaving children alone. But the second you turn 18, you are fair game for the vaping industry and the tobacco industry. And we have to make sure that our policies and programs don't do the same and abandon young adults to look after themselves. They've got enough going on, 18 to 24. There's so much to figure out. The least we can do is help them to look after their health. You may have heard that vapes are safer than smoking. Has anyone heard the statistic that vapes are 95% safer than cigarettes? Have you heard that floating around? It's absolutely not true. Don't believe it. That is a fake fact. Actually, that would make it a lie, right? If something's a fake fact, I would call that a lie. Now I'm speaking in doublespeak. They get into your brain. So that figure, 95% safer, was essentially a few years ago, a bunch of people, including industry, vaping industry interested people, got into a room and sort of started talking and say, what do you reckon? How much safer do you think e-cigarettes are than cigarettes? 95? Yep, let's go with that. And they wrote a paper, no scientific basis, no empirical data behind it, but it's something like 95% safer. That sticks in your brain, right? It's easy to share on social media. It's easy to cite in research papers. It's easy for journalists to say it, and it just becomes somehow part of our health knowledge, even though it's not true. And I think when we think about e-cigarettes being safer, safer than what? Safer than breathing air? Of course not. If you are a heavily addicted smoker and you've been smoking your whole life, say you're in your 50s now, you've tried everything you can to quit, and it's just really hard for you, you can't. And you meet with your doctor, and your doctor says, well, you've tried all these other therapies, maybe e-cigarettes are the thing for you that's going to help you to quit. That might be the right person to use e-cigarettes. E-cigarettes or vapes might be safer for that person, provided they fully switch over from cigarettes. But that doesn't mean that vapes should be available in petrol stations, convenience stores, and grocery stores and being sold to kids, right? There's a big difference around what's happening at a population level and what might be right for someone who has a clinical relationship with a doctor who has struggled with quitting smoking their entire lives. And I think sometimes when we talk about safer, that exceptional case, that small number of people who e-cigarettes might be useful for, gets spread out to everybody, saying everyone can vape because it's safer. So this is kind of what some typical vapes look like. They're disposable, they're flavored, they're full of nicotine, they're pretty cheap, and they're readily available. That's the situation we found ourselves in Australia. Thankfully, things have changed pretty rapidly, and I'm going to get to that by the end of the presentation. But the reason why we started caring so much about vaping is once we sort of came out of our COVID haze, when kids were going back to school, we're back to being able to be in rooms with each other, things like this, vapes had skyrocketed in use. And in public health, we have taken our eyes off the prize and thought we're doing so great in tobacco control, yet this had snuck in the back door and taken over. And they were literally everywhere. I live in Sydney in the inner west, and I was walking down my street one day, and I counted literally between my home and the bus stop 8 places where you could buy a vape. And this is a product, the nicotine version of this product, has never been legal for retail sale in Australia, ever, never. And yet there were 8 places in a 600-meter walk where I could purchase one. And I'm thinking, what is going on here? How did this happen? How did vape shops just seemingly pop up everywhere overnight? They're fun and easy to use. This is what we hear from young people, is that vaping and cigarettes are very different. Vapes are flavored, they're colorful, they're safe, they smell good. They aren't like your grandfather's cigarette, which we know we've really managed to turn around in this country where smoking is no longer socially acceptable. Young people fully understand the health effects that just did not translate over to vaping, seen as something completely different. And when it's packaged like this and available in juicy fruit flavor, and I've smelled this one, it smells exactly like juicy fruit gum. It's amazing. You open it up and you think, wow, how did they do that? What sort of chemical concoction have they put together that they're able to make it smell that way? So what was the problem? Why were we seeing all these vape shops popping up, even though it has never been legal to sell a nicotine-containing vape? All right, so I'm going to take you through this sort of policy problem of what was happening. First of all, you have to ask yourself, are you over the age of 18? If the answer is no, then no kind of vape is legal for you ever in Australia. Nicotine, non-nicotine, flavored, unflavored, all the states had said no. If you're over If you are under the age of 18, you cannot legally have a vape. If you were, yes, okay. Well, do you want a vape that contains nicotine or non-nicotine? If you wanted a non-nicotine vape, you could buy those anywhere. Doesn't matter. And they were virtually unregulated. You could put whatever you wanted in them, provided there was no nicotine. They're highly legal. Flavored, disposable, virtually any other chemical you can think of. You could sell them anywhere, provided you're over 18. If you wanted a nicotine one, well, then you had to actually get a prescription. And if you didn't have a prescription, then you couldn't get one. And if you did have a prescription, you were supposed to get one from either a pharmacy. You couldn't just show your prescription at a petrol station and get a nicotine-containing vape, or you could import it legally from overseas for yourself to use. That's pretty convoluted. And this is why we got into the policy mess that we're in. Because what do you think actually happened? How do you tell the difference between a non-nicotine vape and a nicotine vape? You can't. You just look at them, they look exactly the same. And so what you have to do if you're an enforcement officer is you go to a shop that's selling vapes and you take a sample and you send it to a lab and you get it tested, and lo and behold, here's the big reveal, spoiler alert, they all had nicotine in them. Nobody wants a non-nicotine vape. That is a myth. And so retailers were essentially selling illegally nicotine-containing vapes in broad daylight to children on virtually every street corner all across Australia. And enforcement officers, even they were doing their absolute best, take my hats off, particularly to the state I'm from, New South Wales Health, really trying their best to get a handle on these things. But you might as well set fire to a pile of money, because how could you possibly go to every retailer and test every product and then come back and seize those products? It just absolutely was not working. And this was an inspiration then we needed research to show that young people were easily accessing these products and that our current policy approach simply was not working. This fake distinction between nicotine and non-nicotine was just essentially worthless. But what does the tobacco industry claim vapes are for? So this comes directly from the Philip Morris International website. They claim they're only for adults who would otherwise continue to smoke. Then why on earth do vapes look like this? They are marketed to and used by young people who have never smoked. This is a vape. My colleague of mine from the Philippines sent me this photo. He was on a trip to Thailand, and this is a vape that he could just purchase in a shop. And I've seen other ones that look like SpongeBob SquarePants. I've seen other ones and other cartoon characters, because you can make the plastic that surrounds a vape whatever shape you like. And so wanting to get good data to show that our current policy approach was not working and that there was a really easy solution, end this fake distinction between nicotine and non-nicotine, make enforcement easier, shut down all those vape shops in our communities, and make the prescription model access work. And so we started the Generation Vape Research Project. It started out in New South Wales, but is now a national survey. And essentially, we collect data from parents, teenagers, young adults, and from teachers, asking them about their attitudes, beliefs, and behaviors around vape use. And we also do a sort of focus groups and interviews with young people, so we get that qualitative data as well. But so far, in our 6 waves of data collection, we've spoken to 45,000 participants across those survey models. Just some of the results to highlight for you here. I'm not going to read through them all, but essentially, we know that it's disposable devices that young people are really interested in, but the devices changed really quickly over the 2 years of data collection as well. And now these disposable rechargeable devices, so essentially they're disposable devices that have so much liquid in them, so much liquid nicotine in them, that you can't finish it before the battery runs out. So you have to recharge it. And I've seen vapes that are this disposable rechargeable that have up to 10,000 puffs in them. A little quick math for you. Pack of cigarette has what, 20 cigarettes in it, right? Let's say 10 puffs on a cigarette, and you go outside, you have your break, you smoke your cigarette, you go back to your desk, right? So 20 times 10, we can all do that math, 200 puffs in a pack of cigarettes, 10,000 puffs in a vape, and you can sip on that all day and all night. We have stories from young people that they keep it under their pillow and wake up craving nicotine. It's just a completely different behavior, and because it's so normalized, and because the devices are so attractive, you can see how young people get addicted so quickly. And if we look at the young adults, we ask them, because obviously young adults could legally purchase a vape if they had a prescription, but only 7% of young adults had a prescription for their vapes. Because why would you get a prescription when you can walk down to your local shop and just buy one? Of course you wouldn't bother to do that. But not all bad news. We've seen over the course of the survey as well that people are more interested in quitting vaping as well. So we've seen increasing rates of people agreeing that yes, they want to quit vaping. And for parents and carers, the most sort of significant thing that we've seen among parents is their understanding of vapes. The beginning of the Generation Vape study, parents were really quite clueless, I have to say, particularly compared to their children. But now we see that parents are much more informed about vaping products and they're much more concerned about them. Teachers, on the other hand, have always been clued in. They've known what's going on. They've been frustrated. They've having to seize vaping products at school and enforce no vaping policies. And we cannot put the onus on teachers only to do this. Yes, they're a key part of our community and our response, but we need to support them with policy that enables them to do their jobs. Now, what about the tobacco industry? Well, what the tobacco industry wanted, rather than getting rid of this distinction between non-nicotine and nicotine, is they wanted to weaken our laws. They wanted to see vapes made legal. They said, well, we have such this terrible black market, young people are accessing vapes everywhere, they're available for sale. You know what we should just do? We should just make that legal. We should just allow nicotine vapes to be freely sold all across Australia. And they went so far as to use social media posts by the Responsible Vaping Australia, which is actually British American Tobacco. Fully funded, that campaign is 100% funded by British American Tobacco. And it looks eerily similar to the New South Wales Health campaign, Do You Know What You're Vaping?, which was an education campaign about the harms of vapes, and trying to disguise who they are and what they're doing. And really, the policy they wanted was for their products to be legally sold everywhere. We also saw during the debate over the last year, this ad here, you may have seen a giant billboard. They popped up all over the place. Queensland, I know, had a couple, where essentially these were authorized by the Australian Taxpayers Alliance, who is not forthcoming about their funding. We know they have previously received money from the tobacco industry, but I would suggest that small community donations were not going to be funding these massive billboards all across Australia. And you can go to their website and check it out. And their key arguments were essentially that somehow regulated vapes that were available for sale would be safer, that there was no evidence that getting rid of vapes and only allowing them available by prescription would work, and that even if it did, that GP waiting rooms would be clogged by millions of people, and that our healthcare system would face collapse if we went ahead with these reforms. And now, why do they want to introduce legalized vapes? Why do they want nicotine vapes available everywhere? Because the tobacco industry also manufactures and produces these flavored, disposable, cheap products. And these are the BAT and Philip Morris ones here. So the Vuse is BAT, and Viba is Philip Morris International. And these are the products that are available in other countries that have legalized vapes and made them for sale at a retail outlet. Now, vapes aren't illegal in Australia. They're not prohibited. You just have to get them from a pharmacy, and you have to be an adult. We just don't want them sold on every street corner to school children. And of course, the tobacco industry are master marketers. We know that they continue to have a fruitful relationship with the Formula One. Anyone here watch Drive to Survive? Netflix? It's okay, you don't have to put up your hand if you're embarrassed. It's riddled with tobacco industry marketing. I'm just going to show you now a clip of an influencer. I think I just have to push that. So you can see there, she does her getting ready to go out to a big industry event. She's getting ready, and the last thing she does is put a vape in her handbag. So that's what they want to see happen here. So all of these sort of interests have combined together to dramatically increase vape use in Australia and have it normalized among young people. Thankfully, the reforms that have been introduced in 2024 means that we are no longer going to see the ready access of vaping products. All vapes now will be only available in pharmacies. As of October 1st, they will be behind the counter. You won't need a prescription any longer, provided you're over age 18. And they won't be these disposable, flavored, beautifully marketed packaged products anymore. They will look like proper pharmaceutical goods. But of course, the industry is very adaptive. And some of you may have heard of nicotine pouches. And these are the next trick that we're going to be seeing marketed to young people, coming in bubblegum and apple mint flavor. So our work's not done yet. Thank you very much.
Thanks, Becky. Jasper, how did she go? Pretty good. Certainly the thumbs up from your son. Now, not only is your information great, Becky, but the way you can engage us is too. Thank you. Now it's time to hear from Dr. Sandro Di Maio. Dr. Sandro Di Maio is the CEO of Vic Health, a medical doctor and a globally renowned public health expert and advocate. He's also held the role of medical officer for non-communicable conditions and nutrition at the World Health Organization. Originally worked at Melbourne's Alfred Hospital. He holds a master's degree in public health, a PhD in non-communicable diseases, and has held fellowships at Harvard Medical School, Copenhagen School of Global Health, Johns Hopkins Bloomberg School of Public Health, and the Uni of Melbourne. To date, he's published more than 40 scientific papers, including coordinating the 2019 Lancet series on nutrition. And we are delighted for you to join us this morning. Ladies and gentlemen, please welcome Dr. Sandro Di Maio. Thank you.
Thanks very much, Madonna. I too will just start by acknowledging the traditional owners of the land, these beautiful lands that we're on in Brisbane this morning, and acknowledge these lands always were and always will be Aboriginal land. I'd also like to thank Robin. What an absolute champion, Dr. Rob. Queensland, you are so lucky to have her. Victoria feels jealous. If we can ever get you down there, just give me a call, Rob. But I think the 5 years that since Health and Wellbeing Queensland started, and the incredible legacy speaks for itself. But I do just want to give you a very big shout out also to the board and to the team. It does take a team to make these amazing things happen. And finally, Associate Professor Freeman, you've set up my presentation nicely for me, because I can actually skip a few things and make up a little bit of time. A champion of tobacco control and e-cigarettes, and really we've built our work at Vic Health very, very much on the shoulders of people like Becky and others who have built the formative evidence that allow us then to implement the programmatic and policy responses. So as mentioned, my name's Sandra. I'm the CEO of Vic Health, Robin's counterpart in Victoria. And I just want to talk a little bit about the work that we're doing in the vaping space, and particularly some of our programmatic and policy work across communities throughout our great state. So it's important always to look back both at the, I suppose, parts of history that we've forgotten and now find ourselves repeating, but also the incredible legacy that we have in Australia that we should be always proud of and always protective of in tobacco control. And of course it started, or a defining moment I should say, in our history was just over 10 years ago when Australia took plain packaging to the world. And not only I think accelerated our progress in achieving one of the lowest smoking rates on the planet, but also created a pathway, a slipstream for so many other countries to be able to follow and have the confidence. Yes, we were taken to the World Trade Organization and sued for doing our jobs as public health experts and governments by the tobacco industry, but we were successful in those challenges, and ultimately gave the confidence to many countries around the world to take bold action as well. And we've seen, plain packaging spread across the planet. And I think in many ways, where we stand now in 2024, and the reforms that Becky spoke about, that we've been able to pass here under the leadership of our current health minister, hopefully will have a similar effect and create that similar slipstream for health policy progress. Because we have seen this remarkable, terrifying increase in e-cigarettes in just a few short years. And Becky talked about this, but I think we need to also acknowledge, again, the disgusting and predatory behaviour of industry. That fundamentally they used the pandemic, they used young people in high levels of psychological stress at home, parents struggling to find their way through a pandemic, in and out of lockdowns, and turning to a digitalised life to stay safe, to stay online, to stay educated, and to stay in employment. And it was that environment that they used to exploit young people through social marketing largely, and the digital platforms to get so many young people addicted to these harmful products and create a new generation of young Australians addicted to nicotine. And we've talked about this already, but you know, the predatory nature, again, the flavours, the colours, the single click through Snapchat and a Camry turns up outside a primary school. You know, parents have no hope of being able to control this or even really understand fully what's going on. And this was very much the MO of the tobacco industry for 50 years. And in the last 20, we sort of had this moment of reprieve as we continued to increase effective policies and see tobacco rates across the country fall. But a feeling of complacency crept in, and in many ways, history has now once again repeated itself. So as we look to design our policy and programmatic responses, as we continue to work very closely with experts like Becky and Emily Banks and others across the country on the federal policy reforms, we were also turning our attention very acutely to what we could do as an agency in Victoria, the agency that's brought QUIT and the QUIT line, funded the Cancer Council to deliver those programs for more than 30 years, and how we would continue to innovate and reinvent those programs for a new generation and a new product, but from the same industry with many of the same tactics. And so, of course, one of our key approaches was to actually ask young people, co-design our program responses, programmatic responses with young people and get their inputs. So I'm going to quickly take you through some of the responses that we have invested in. So the first is we've invested in what we call our collective impact investments. And this is really about reaching young people where they're at in all the places and spaces where young people spend time, ensuring that we're giving the support to formative organisations and individuals in their lives, giving them the tools to be able to respond, whether it's teachers or sporting clubs, whether it's universities or local governments. All of those environments, given the urgency and the scale of this challenge, we brought on board in a collective impact sort of place-based approach. So this was very much kind of the bottom-up to the work that we were doing federally with Becky and others on the federal vaping reforms top-down. And it was about activating and engaging local communities to design responses that served and worked first and foremost for them. So this included grants to community organisations. We married that with a partnership across universities where young people were spending time, and TAFE and other educational environments, and of course partnering with the many organisations, including coaches, which have enormous influence on young people, giving them the skills and tools to be able to have conversations about the harms of e-cigarettes, but also support and point young people in where to go if they're looking to quit. We strengthened many of our existing partnerships, so we worked with the Cancer Council, Victoria and QUIT to not only update and launch a WhatsApp-based cessation support line for young people who had not grown up with the same affinity and, I suppose, trust in the QUIT brand that many of us hold and older generations have seen after decades and decades of, world-leading television commercials. These young people didn't have the same understanding and trust of the QUIT brand, and so the opportunity to launch WhatsApp-based and even using chatbot-based cessation support lines, also working with them in schools and through supporting GPs and primary care. We also worked with a range of local government local governments. So as time went on, it became clear that local governments across the state were starting to respond in different ways. And so we leveraged our existing investment, the Vic Health Local Government Partnership, working with 35 councils across the state, long-term strategic partnership aligned with their health and wellbeing plans. And we brought together communities of practice, councils who were really actually already taking action to compare notes, to be able to innovate together, to share concerns and understandings, but also to bring experts through forums to those local government leaders and strengthen their ability to respond at that community level for their communities across the state. This included even launching and funding a number of place-based campaigns. I was up in Ballarat not long ago, and they've developed a fabulous local campaign, completely filmed by and with young people, and it's now being shown in the local theatres across Ballarat and on local public transport. And these are local faces calling on other young people, addressing the health harms and risks, but also giving them information on how to seek help. Building on the important work of, again, Associate Professor Freeman and others, we needed to understand the different, I suppose, phenotypes of young people across the state. So yes, we could see that young adults were had the highest rates of e-cigarette use. Yes, we could see that we'd rolled out in grades 7 and 8 across every state high school a resource for teachers to be able to have evidence-based, meaningful conversations with young people. Yes, we'd supported GPs with the Royal Australian College of General Practitioners in Victoria and the Royal Children's Hospital to update information and have real-time evidence-based responses for clinicians. But as time went on, it actually became very clear that it wasn't grade 7 and 8, but it was actually frighteningly grade 5 and 6, 10, 11-year-olds that were where we were seeing the kind of first introduction of e-cigarettes and the industry really refocusing. So we had to continue to innovate. We then developed and invested in resources for primary and early secondary schools. And we also released a suite of supports for parents, including conversation guides. And this was all based on evidence that we did in partnership with the Behaviour Change Collaborative, which was really looking at the different types of young people and everything from young people who were not vaping and deeply concerned and trying to basically avoid it, all the way through to young people who were addicted and looking for support and cessation, because the response as we went forward we realised needed to be very different, not just for the age groups, and we had a social marketing mass media campaign for young adults through Quit, and then eventually relaunched Victoria's first peer-to-peer based anti-vaping campaign for teenagers. But it was very clear also that we needed to actually have a different response for those who were, I suppose, not yet exposed and looking to avoid them versus those that were addicted and looking to quit. And as I mentioned, on the far right is the latest campaigns. This is a campaign that we're actually gifted from a philanthropic donor and able to adapt for Victoria. So it's a peer-to-peer based campaign. Young people log on to this website, Uncloud. They create their own health warning labels and then share them on social media with their peers. And it's been hugely successful in terms of clicks, but also clicks through. So they go to that website, they share the information with their peers, and then the call to action is to either get information if they're looking to grow their health literacy, or of course click through to a WhatsApp-based Quit service delivered by the Cancer Council and Quitline and funded by Vic Health. And finally, the work kind of never ends, and I think we can talk about, we'll probably talk about this more on the panel in a second, but for us in Victoria, where it's one of the places where we're behind the rest of the country and still playing catch up. So we don't have a licensing scheme for tobacco in Victoria. That's something we're very focused on. That will be then combined, obviously, with the vaping reforms. So federal policy, there is a state response that's required. We're supporting local governments across the state and then supporting communities up. This is a hugely complex and urgent issue. There is really no greater issue of urgency, I think, for our young people in terms of the next sort of 12 to 24 months. And so we're investing in all the places and spaces we can and at every level of government. Finally, the key takeaways, I suppose, in terms of that we've learnt or that we've relearnt through this process, and this does come back to some of the speakers and what they've said earlier. When we're designing these programs with young people, for young people, what they're looking for, what we've learnt they're looking for from us, in addition to it being place-based and really designed by communities, for communities, are these four elements. And that's really where a health agency like Vic Health comes into our own, to be able to be authentic and really, I suppose, designing it based on the insights that we're hearing in real time, being transparent, empowering, of course, the trustworthy brand of government, and being evidence-based at every point. And with that, I'll hand back to Madonna. Thank you.
How much information you can pack into 14 minutes. Dr. DeMeo, thank you. Please join me in now welcoming our final speaker, Ms. Vivian Chaishu. And Vivian is a Senior Specialist of the Tobacco Control Division of the Health Promotion Administration, Ministry of Health and Welfare in Taiwan. She's worked in health promotion and chronic disease prevention at the central government for more than 15 years, and she fully participated in the amendment process of the Tobacco Hazards Prevention Act in Taiwan, which took effect last year. Experienced in health policy making, community health development, capacity buildings of healthy city, health literacy and health communication. Please join me in a warm Brisbane welcome for Vivian. Thank you. And there's the counter there.
Thank you, Dr. King, for your kind introduction. This is my second time visiting Brisbane. Last time is 20 years ago. So I'm so delighted to be here again. Brisbane is a very lovely place. And today, it's my pleasure to share about Taiwan's tobacco control strategy and the new regulations and measures which have been taken in effect last year. And the outline here will compose for 4 parts. Firstly, I will share about Taiwan's follows WHO, FCTC, and Empower strategy to conduct tobacco control policy. And the second, with the amendment of the Tobacco Hazard Prevention Act we just accomplished last year with the aim to address and tackle with the novel tobacco products. Third, the smoking cessation services reform. Lastly, future outlook. Sorry, maybe it's... Yes. Before talking about tobacco control, I will brief you a little bit about Taiwan's health profile. And as you can see from the map, Taiwan is to the north of Australia and is a country with 23 million population. Population age under 15 is around 12%, and population age over 65 is 18.5%. And next year, it's established that we will reach 20% of the old population and will be so-called super-aged society. The life expectancy is around 8 years old, and the national health insurance coverage is 99% with a satisfaction rate up to 91%. The first version of the Tobacco Hazard Prevention Act was implemented in 1997. It includes a ban smoking in designated indoor place, limited the selling tobacco, health warning covered 20% of the package services, labeling, and limited the nicotine and the tar concentration, and the partial ban on mass media advertisement and the discount. In 2005, when WFCTC was entered into force by the UN, Taiwan, as one of the global partners, also immediately endorsed this international treaty, and which was ratified the same year by the President for participation. Meanwhile, we amended the Tobacco Hazard Prevention Act, incorporating FCTC into our law. In addition, Taiwan tobacco control policy also follows the WHO Empower strategy. After 25 years' efforts since 1997, this slide shows the prevalence of the adult smoking rates has dropped dramatically. It's almost over 50% decreased from 92% in 1997 to 14% in 2022. Not only the adult smoking rate decreased, the rate of the smoking, the senior high school student declined by 50% to 7%. The rate of the junior high school student declined by 72% to 2 points. When monitoring the prevalence of the e-cigarette use, In 2022, the e-cigarette use rate for adults above the age of 18 was just only 1.4%. However, the e-cigarette use rates for junior high school and the senior high school students were 3.9% and 8.8% in 2021, which was rapidly increased from 2.5% to 5.6% in 2019. In addition, most of the e-cigarette users are non-smokers. In 2022, the heated tobacco use rate for adults above the age of 18 was 1.4%, and 0.8% for junior high and 0.1% for just senior high. In response to the rapid change in tobacco landscape, we've just amended the Tobacco Hazard Prevention Act last year. The key components of the amendment include a full ban on intimate tobacco products, thus prohibiting the sale of e-cigarettes. Second, enabling the health authority to designate tobacco products to undergo health risk assessment review. Third, raising the legal age to smoke from 18 to 20. And expanding the scope of the non-smoking places, university, kindergartens, and the nursery will be entirely smoke-free. Lastly, increase the penalties. After the new regulation took effect, the HPA, Ministry of the Health, collaborated with the other ministry at the central level as well as the local level, working together with the city, county health authority to conduct the disposition, investigation, and the punishment of the illegal products. At central level, collaboration with the different ministry and the department on border check, source tracking, circulation audit, education and communication, cessation, treatment, and counseling. The enhanced crackdown has been initiated since last month, March, for online monitoring website, social media with keywords. Once found with distribution of e-cigarette, then forward the case to the local health authority for investigation and disposition. In addition, the performance in online distribution crackdowns and handling of the petitions has been included as part of the indicator in the evaluation of local governments. Moreover, HPA encouraged city and the county to enact rewards for reporting violations of the Tobacco Hazard Prevention Act to give incentive for general public. Regarding the measurement over the heated tobacco products, only for those which undergo health risk assessment review and being approved by Ministry of the Health can be marketed. In addition, based on the international practical management experience, the announcement of the draft of the prohibiting additives has been just made for a 6-day period comments. The investigation result after the new act are here for your reference. In order to understand the dissemination of e-cigarette on social media and the website, the legislation affects their spread. The study covers 6 months before the amended implementation and 6 months later as the observation period has been done. Considering the characteristics of the media, usage rates, and the impact of information dissemination, the study selects Facebook, Instagram, YouTube, and the TikTok as the social media for observation. There are 3 findings. The first, the reduced message dissemination. In the initial phase, there was a significant reduction in the number of e-cigarette-related posts. However, 3 months later, the number for the posts rebounds. Second, change of the setting and the word choice. Public e-cigarette group on Facebook become private ones. E-cigarettes are addressed in new names such as e-juice or something like else to evade government monitoring. Third, shifting the message content. Content on social media transformed from user experience and the product introduction to policy discussion and the message inform. After reviewing these findings, we enhanced the online platform self-regulation and the cooperation this year by communicating regularly with the platform partners on legal compliance and the self-monitoring mechanism, which include a shared product monitoring and review mechanism, established member identity verification mechanism, and established consumer policy channel with Google and Meta, and asked them to remove the illegal information. And for the self-hosted website, cooperate with the Taiwan Network Information Center to cancel the domain name, but it's still very challenging for tackling. Another part of the smoking hazard prevention is the cessation services. There are a variety of smoking cessation services available in Taiwan, including workplace smoking cessation hotline, smoking cessation classes, and the smoking cessation service provided by medical institutions. There are a total around 2,700 contract medical institutions. The successful rate is above 30%. The smoking cessation service is beneficial, and per person that successfully quit smoking, either in short term or long term, saves money. In order to expand the provision of smoking cessation services and elevate the economic burden smoker, the services have been reformed more accessible and increased its quality and availability. For service provider, we have adjusted the training hours, and the payment was increased to encourage the more clinic and the hospital to provide smoking cessation. In addition, promoting smoking cessation service in all medical specialty. For service user, there is no longer co-payment for drug fees, so people should be more willing to engage in smoking cessation. Moreover, smoking cessation service is integrated in National Chronic Disease Prevention Plan since 2 years ago. With the goal in next 8 years, we hope to achieve 80% of the chronic disease cases enrolled in the Rehigh Care Net. And the second, 80% of the enrolled receive lifestyle management counseling. Third, 80% of those who receive the counseling with a stable outcome. We named 888 plans and upgrade the incentive of the smoking cessation to medical provider to join together. The expansion in warning illustration from 35% to 50% of the tobacco product container service area is modified in this time of the Tobacco Hazard Prevention Act as well. Regarding the communication and education tobacco hazard prevention, education material have been developed on campus from kindergartens to colleges and the university. Central and the local government use key opinion leaders and social media to promote e-cigarette hazard prevention. Educational material for the enforcement of new Tobacco Hazard Prevention Act also provided. In order to promote tobacco-free hospital, we joined the Global Network for Tobacco-Free Healthcare Services. And by 2023, last year, a total of 218 and 17 hospitals have joined. Among them, 40 hospitals have got foreign membership. Lastly, the future outlook. Elimination of the e-cigarette and the illegal products such as heated tobacco products that are unable to pass the health risk assessment review. Post-marketing monitoring and the control mechanism for heated tobacco products. And in engagement of the practical and enforcement regulation governing flavored cigarette. And we hope the adjustment of the teenager smoking cessation service according to the empirical evidence of the novel tobacco products. Finally, rising public awareness, persistent diverse communications among respect target population for tobacco hazard prevention. That's my presentation. Thank you so much.
Thank you. Thanks, get over here. Thank you, Vivienne. And I don't want to stand between our audience and morning tea, but I would like to ask a couple of quick questions and take a couple from you. So if you've got a question, you might make yourself known and we will get a microphone to you. But can I ask for fairly brief answers? And I'm going to start with you, Becky. You make the point new ways keep opening up in terms of access to e-cigarettes. Is there anywhere in the world that's got this right? Anywhere where we can learn from and adopt something they're doing?
Well, we're quite lucky in that I think we're being leaders here in Australia, actually. There's other countries that have just allowed e-cigarettes, vapes to be sold as a consumer good, which I think was the absolute worst thing you could do. Other countries have just banned them completely rather than having a prescription pathway for adults. They've just said, no, we're not, the science is not compelling enough to have these products available at all. And everyone's going to be watching what we do here. So it's essential that we evaluate and monitor what happens. My feeling is that we have seen the peak of vape use, that our next time we do some prevalence data collection at a national level, get those National Drug Health Hold Survey, I think we will either see a slight decrease or the numbers will hold. And then the optimist in me hopes over the next couple of years we'll see those numbers start to come down. And if we do that, we'll be leaders.
So is that of vapes or the latest iteration of them, which includes these upper deck lip pillows and Zyn and snus?
Look, we don't know anything about nicotine pouches. That's what those products that I showed at the end were called, nicotine pouches. We have really no national data available on how much those are being used by young people. We have a lot of anecdotes. I can say in our Gen Vape survey, we managed to sneak in a little question, and we know that 18 to 24-year-olds who smoke, 20% of them had used a nicotine pouch. So I think if we don't want this to become the next vape epidemic, we need to act now.
So the legislative moves we've made against vapes, will they envelop those, or do we need something different?
No, it's a totally different product. And so we're back to where we started. It's because they have nicotine in them, you can't just go around adding nicotine to whatever you want and selling it in a store. This is why we don't have like nicotine water or nicotine gummy bears available for sale. And so a nicotine pouch is an illegal product in Australia, unless you get a prescription from a doctor and you import it from overseas. So we do have a big loophole there that could be shut down.
So you're health minister for a day. There are no bars on what you recommend.
Ooh.
What would really substantially change the trajectory here?
I'm going to be quite bold and say we've taken care of the supply of vapes now. We've said these should not be consumer goods. Why are they available for sale on every street corner?
Yeah.
Why aren't we doing that with tobacco? Cigarettes kill 2 out of 3 people who continue to smoke, and yet probably within a 1 kilometer circumference of the center, I could find more places that sell cigarettes than sell fresh fruit. Yes. And that just should not be allowed. They should be unavailable, hard to get your hands on, and not easily accessible alongside fresh fruit, vegetables, milk, and bread.
Isn't she just terrific? Thank you. I'd like to take it to every school in Australia. Thanks, Becky. Sandra, can I come to you? You talk about the disgusting and predatory approach by manufacturers and that young people have the highest rates. Can you just break that down? Is it a particular cohort in terms of gender or socioeconomic or country versus city? And what is the reason? I smoke because my parents told me not to. Is it that? Is it the lure of social media? What is driving this upswing in rates?
Yeah, I'm not going to sit next to a national expert in the first question and mansplain, so I'm going to hand that question to you, Becky, in a second. On the second question, I mean, the evidence is that it's been because of social media. It was a very unusual and difficult time during the pandemic. Young people turned, almost everything they did to be safe was online, and those spaces are not as safe as the physical spaces we live in. Now, there are bigger questions around how we regulate the digital environment. Gambling. We wouldn't allow kind of kids to be bombarded in the same way in many ways. At school with gambling ads. And yet, if they're trying to do school online, they'll be seeing gambling ads, and they'll be seeing alcohol ads, and they'll be seeing, e-cigarettes, and some of those are through more kind of clandestine, indirect marketing that's not properly disclosed, and some of it is actually just, the fact that our digital protections don't work. So that's a whole nother issue that we need to talk about as a country. But on the first, and so I think, big driver has been a very, very much a kind of grooming effort by industry of young people during one of the hardest times they will ever experience in their lives, hopefully, and when they were forced to be in a very digital world and where parents have no hope. If I sit on the couch next to my nieces, they are in a completely different digital world to what I'm in. It's not like if you're driving down the freeway and you all look out the window and see a a billboard and you can have a conversation about what you're seeing. I have no control. I really have no idea what they're seeing, and it's very hard to put controls in place given that, work, play, education, they need to be online. So that's a big conversation we need to have as a country. But I'm going to hand to Becky, who actually led Gen Vape, to talk about...
Before you do that, our own Chief Health Officer, who we will hear from tomorrow, has come out saying, that social media is a new almost virus that started in 2010, and he would now call it an epidemic for our children across Australia. Would you agree with that language?
Yeah, I think we have to be careful because it's unavoidable for young people, employment, education, social connection. There are benefits that have come from a digital world and a digitalised world, as distinct from social media, but I absolutely think we have huge questions and conversations we have to have in this country around the fact that we allow the data of our young people to be just sold off at at the highest price to foreign entities, to be held on foreign servers, and then be on-sold to companies that are selling products that we know, they know, everyone knows comes at the cost of their collective futures.
And our governments are really struggling to regulate the power of our social media providers in a whole lot of areas. What's the chance of them being able to do something that makes that upswing in vape use turn the corner, in your view?
Well, I think it does come, in many ways, it does come back to those bigger... So we've for me, as a public health CEO, the first priority was we needed to have good, solid federal and state legislation.
Yep.
We've now got that. State is still coming in Victoria, but we're making progress. We then needed to kind of put the emergency piece, the mitigation piece in place, so get young people, raise awareness in all the spaces and places where young people are spending time, get them sharing information in a way with their peers so it's trusted and credible and has an impact, and also give young people who are addicted in record numbers a viable and culturally appropriate and safe way to get off nicotine. Yeah. I think, now that those things are actually increasingly under control, not finished, but certainly under control, more than they were 12 months ago, the conversations turn to those bigger conversations of data and privacy and how did we get here in the first place, and how do we not just continue to play whack-a-mole when not even the next tobacco or nicotine product comes along, but the other products we're not talking about, including gambling, alcohol, and harmful food and drinks. The digital space, the idea that the data of our young people is kind of bundled up and sold off, and that parents are powerless. The idea that we can point the fingers and say, be a better parent, is quite frankly insulting. Yeah. This is the domain of government, and I should just say, it's not impossible because we're being left behind. Europe has done this. They've got much stronger data privacy laws than we have. I was recently in Europe, and every time I went on a website, it had to ask for my permission to use my data. Yeah. In Australia, we don't have that. So there are things that we could be doing that we're being left behind, and they're the low-hanging fruit, but that's the next frontier, I think.
And I love that phrase, play whack-a-mole.
Yeah.
Becky, just very briefly back to you in that cohort question. Where is this upswing, in what particular cohort, and why?
Look, the age of taking up vaping we know is as young as 11 or 12, and by age sort of 18 we see half of young Australians have at least tried a vape. At
Boy or girls though?
It's even. There's no sort of it's all a woman's problem or it's a men's problem.
Rural,
it's across.
Rural or city?
Again, it is, most health issues we can say, it's more likely to be concentrated in lower SES groups or whatever. We are not seeing that with vaping because it is so widespread.
Educators have thrown their hands up on trying to even change the architecture of toilets in school grounds. Yeah. Is there any particular education landscape where there are fewer vapes?
Look, we have seen over the Gen Vape study over the past 2 years of teachers sort of saying, look, it's not as big of an issue at school anymore. But that doesn't mean it's not an issue. They're just getting better at policing it at school and doing it. And children are very adaptive as well and better at not making it obvious that they're vaping at school. Yeah.
Vivian, can I ask you, you're an expert in prevention and in health promotion. How important is it to separate the messages in prevention from a 12-year-old who might be doing it because all their friends are, and a 62-year-old who might think it will help them stop smoking?
Yes, thank you for your question. And because as a health promotion central agency, we just taking a setting approach for health promotion and health communication and education. And we collaborate with the Ministry of the Health for the students, because the students stay at school most of the time. And we cooperate with the Labor Ministry for just the workers or the general population, because they stay in the work time is more. So we just doing the different message to different setting, and we also do just the mass media for different content for each group.
Okay, thank you. Do I have a question from the audience? Yes, let's just take one or two. Thank you, sir.
Yeah, thank you for all of the presenters. It is very learning experience for us. I am from Bangladesh. I have a request, not any question, to Becky. Bangladesh is now amending our tobacco control law, and under the law, there is a proposed provision to ban the e-cigarette and vaping. But what the industry is doing in our country now, they are trying to say that since e-cigarettes are 95% less harmful, as you mentioned, so it has to be regulated rather banned. So we need a counter evidence so that we, the tobacco control advocate, can use it to defend the myth of 95% less harmful. So I have a homework request to you.
Okay, I think so. What is the evidence, Becky?
Yeah.
Oh, look, and please, I'm very easily findable online and always welcome emails, phone calls, Zoom calls with my international colleagues. So please, very happy to talk to you. And look, I encourage you to hold fast against the industry. These are not a product that you need in your country, absolutely not. And to exercise your regulatory right to say no, the industry does not get to dictate what's available. Please do contact me.
Oh, thank you, Becky. But before we end, can I ask each of you just for 30 seconds, when we wake up in 2 weeks and we're back at our desks and we're running our programs and thinking about this issue, what is the most important message you want to leave us with? What do we need to remember from your presentations today? And can I start with you, Vivian, and go down the line?
I think we just do it repeatedly to the either in the just the general population or to the each kind of group. Just do it repeatedly.
Be persistent. Sandro.
I think I'd reiterate a message we've heard a number of times this morning, and that is when we're creating responses as public health agencies, create them with communities, not for communities. The challenge looks different from community to community, and they generally know what solutions will work. And we found that approach to be the most successful in addressing vaping.
Thank you. Becky, final word?
We put a lot of effort into understanding health issues and doing research and evidence and prevalence rates. And I urge you to put that kind of energy into understanding the commercial determinants that impact our health as well, to understanding vaping companies, tobacco companies, gambling companies. Because until we can understand how they're targeting our young people, we can't hope to put a lid on it.
Ladies and gentlemen, please join me in thanking Professor Becky Freeman, Dr. Sandro Mayo and Vivian Chaishu.